prompting, assisting, and administration of medication in a care setting. Any care service provision should be based on the desired outcomes of the person who uses the service. This may require an assessment of their existing medication capabilities and needs. This assessment is central to the success of managing medicines in the delivery of home care. It should be made with the input of the person themselves or advocate, such as a family member if required, and be included in the care plan that details the agreed roles and responsibilities of care workers, the person themselves, and any other people involved. Various people may do the assessment, including members of the primary healthcare team, social work staff, or an Oasis Care senior staff member. Assessment of an individual's medication covers a person's understanding of their medicines, as well as motivation and physical ability to take them. It should also look at any help needed with ordering and collecting prescriptions and so on. An assessment of a person's capabilities may show that they do not need any help from care staff with their medicine. For example, when it is clear that a person may occasionally forget to take his or her medicine, simple approaches, such as the person taking the medicine when they first get up out of bed in the morning, or with meals, or setting a timer, may help. The assessment could also show that the person is essentially able to retain control of his or her medicines, but need assistance with simple mechanical tasks, such as opening bottles or requesting repeat prescriptions from the GP, or an occasional verbal reminder from the care worker to take medicines. Care staff may be required to prompt, assist, or administer medicines. Staff should be clear of the difference between these roles, so let's look at each one now in more detail. The dictionary definition of prompting is the action of saying something to persuade, encourage, or remind someone to do or say something. Therefore, prompting medication is reminding a person of the time and asking if they have or are going to take their medicines. The person is still in control of their medicines and may decide not to take them or to take them later. Prompting can be useful when a person knows what medicines to take and how to take them, but may simply forget the time. If carers are expected to prompt a person to take their medicine, they need to know what time of the day to do this. The Care Quality Commission is aware of examples where people were prompted to take all of their medicines irrespective of whether they were due. This resulted in one case of a person taking warfarin 3 times a day instead of once a day, with serious consequences. A person may be able to retain control of his or her medicines, but need assistance from the care worker with simple mechanical tasks. Assisting with medicines can include ordering or picking up repeat prescriptions from the GP surgery, collecting dispensed medicines from the pharmacy, bringing packs of medicines to a person at their request so that the person can take the medicine, opening bottles or packaging, including multi-compartmental compliance aids, at the request and direction of the person who's going to take the medicine, reading labels and checking the time at the request of the person who is going to take the medicine, ensuring the individual has a drink to take with his or her medication. As with prompting, the person is assessed as being able to self-medicate and is in control of their medicines. This independence should be supported. A pharmacist may be able to offer options for support in self-managing medicines based on the identified needs of the person requiring care. If a person cannot take responsibility for managing their medication, care staff may be needed to ensure that the person gets offered or is given the correct medication at the correct time and in the correct way. This is defined as being considered administration. Administration of medicines is one, all, or a combination of the care worker doing the following: deciding which medicines have to be taken or applied and when this should be done, being responsible for selecting the medicines, giving a person medicines to swallow, apply or inhale where the person receiving them does not have the capacity to know what the medicine is for or identify it, giving medicines even at the request of the person receiving care where a degree of skill is required to be exercised by the care worker to ensure it is given in the correct way. The level of support a person requires may vary, with the person taking more or less responsibility over time, depending on their health and capability, and with the medicine itself. For example, a person may self-administer an inhaler, require care staff to give them tablets, and community nursing staff to give injections. Sometimes a person needs medicines administered that care workers are not normally trained to give, such as medicines that use specialist or invasive techniques. Some examples include rectal administration of suppositories, insulin given via pre-filled pen devices, administration through a peg tube, turning oxygen on and off. This type of medication will normally be administered by trained healthcare professionals, not a care worker. The Royal Pharmaceutical Society defines a multi-compartment compliance aid, or MCA, as a repackaging system for solid dosage for medicines such as tablets and capsules, where the medicines are removed from manufacturer's original packaging and repackaged into the MCA. When handling MCAs, do not break a tablet in two, open or divide capsules, give advice about over-the-counter medication, use the service user's medication. Whether you are prompting or assisting the service user, it is very important to 1. Check medication details on the Medication Administration Record, also known as the MAR. 2. Check the care and support plan to confirm if the medication should be prompted, assisted or administrated. 3. Offer the service user water or juice to be taken with the medication. 4. Always confirm that medication has been recorded in the service user's logbook before you leave their home. And 5. Record medication taken on the MAR sheet and sign it. It is also important to report any changes to medication to your supervisor. This includes possible or suspected side effects from the medication, medication refusal from the service user, or, more seriously, a medication error, an action that should be taken immediately. Finally, let's now summarise the main learning aims of this video. To begin with, all care staff must have a good understanding of the difference between prompting, assisting and administrating medication. Use your training handout to make sure you can verbally define each one. Always examine the service user's care plan to decide if you should prompt, assist or administrate medication, or seek advice from your supervisor. Medication should be recorded in the MAR and logbook. Do not administer medication you have not been trained in or would normally not be done by a care worker. And lastly, medication errors should be reported immediately. Thank you for watching this video.